Hey guys, we'll go over that test today because we're not going to have time to go over it in class this week since we're going to have some people from AreaVac here doing a landing zone class. There's a couple students that have not gotten to take it yet, so this may give them a little bit of an unfair advantage. But the point of this was for you guys to understand your weaknesses if you have any. A lot of you guys did really well. Kind of use this more like a study guide. You know what you know and what you missed on the exam. You can go back and study and try to make sure that you have a better understanding of it. So we'll just go through the questions and kind of provide some explanation for why the correct answer is correct. Some of these are written a little bit more like the National Registry exam will be, where you can use deductive reasoning to eliminate some of the question or the test answers. So I think everyone got the organisms that cause infections, such as viruses and bacteria. Describes which word that is pathogen. Which of the following is not one of the 5 stages of grief? I put a bunch of questions like that. What's not, try to capitalize it for you guys. The National Registry loves to ask questions in this manner where they will use everything except or not. Sometimes those words will be bolded or capitalized, and sometimes they're not. They're kind of hidden in the question. So make sure that you're paying attention to those words. I suggest when we go do the National Registry test, read the question twice and make sure you understand what it's asking. So which of the following is not one of the stages of grief? It is irritability. You guys can look up the 5 stages of grief, but bargaining, denial, and acceptance are all, those are 3 of the 5. Who is the person responsible for calling when to log roll the patient? That is the person at the head end of the patient. They have to be ready to, because if we're log rolling a patient to get them onto a spine board, they're in a C-collar or somehow cervical spine stabilization is taking place. So that person has to be ready to roll with the patient and keep that patient in line. So that's the responsibility for the provider at the head, regardless of their license level. Causing bodily harm or restraining a person best describes which word? That's battery. Assault is the threat of violence. Battery is when you actually perform the violent act. The prefix chole refers to which organ? That is gallbladder. The testes and ovaries are part of 2 body systems. That is the reproductive and the endocrine systems. Remember, endocrine has a lot to do with hormones. So beyond being a part of the reproductive system, they are part of the endocrine system because they secrete hormones. The autonomic nervous system is divided into the sympathetic and parasympathetic nervous systems. Which of these 2 are responsible for the fight or flight response? That is sympathetic. The other one is you call it feed and breed, rest and digest. Probably not the best way to remember it, but how I remember it is parasympathetic. It's like paralyzed. Those people don't have the ability to fly or fight. A response to being startled, in which the infant throws out both arms, spreads the fingers, then grabs with the fingers and arms, describes which reflex? That is the Moro reflex. I threw in some GCS ones. So when you go take your National Registry exam, they give you a marker board or a piece of paper to take notes on. The first thing I do before I start an exam is I write down the rule of 9s and I write down the GCS because I know it when I'm not answering a test question. But whenever I have to sit there and read a test question, it could go out the window. So before I start the exam, I write down those things. So you guys need to take it on yourselves to study the GCS enough to be able to determine the correct GCS. There shouldn't be a lot of questions, but there may be some. So on this one, the GCS was 8. The patient is responsive to pain, making incomprehensible sounds, and flexing to pain. And that's something we're going to go over more when we're doing scenarios over the next few weeks. So the above patient has snoring respirations, a laceration to the back of his head with venous bleeding. What is your first intervention? The correct answer is jaw thrust. Some people put NPA and head tilt chin lift. So remember, almost everything we do has indications and contraindications. A contraindication to an NPA is head trauma, and a contraindication to the head tilt chin lift is also head trauma. So when it comes to head trauma where we're worried about possible spinal injuries, we do the jaw thrust so that we're not manipulating the head. The formula tidal volume times respiratory rate is to find which of the following. That is minute volume. If you think about the respiratory rate, it's how many breaths per minute. Then the tidal volume is what each breath is bringing in. Those two multiplied by each other is the minute volume. That's how much over a minute, how much volume we're getting in and out of our lungs. Which of the following threats or life threats are addressed first? Circulation, breathing, airway, or hemorrhage? The answer is hemorrhage. We can't circulate without blood in the circulatory system. And even if we have good airway and breathing, but we haven't stopped the bleeding, there's not blood for transportation of everything. You respond to a 68-year-old female patient with the dispatch information of short of breath. Upon arrival, you find the patient lying supine on the floor, unresponsive. What steps should you take first? The correct answer would be to assess a pulse and respiratory status. You could probably also add mental status in there, but they're unresponsive. So a lot of times respiratory calls can progress very quickly. So our first step needs to be verifying that they're unresponsive and then assessing a pulse, so we need to know if we need to start CPR. Which artery are you auscultating when you assess a manual blood pressure? That's the brachial artery. That is the one up here in your arm. The E in the sample history mnemonic is for events. What is a possible cause of bulging fontanelles in pediatric patients? The answer to that is meningitis. A few of you guys did put meningitis. Most of you put fever. If you think about what a fever does, that dehydrates you. So if the pediatric patient is dehydrated, those fontanelles will be sunken and not bulging. What is a contraindication of administering aspirin? So we have a known GI bleed, patient on erectile dysfunction medications, patient with a previous history of a stroke, and a patient experiencing chest pain. This is another question I think a lot of you guys may have misread. A lot of people answered patient experiencing chest pain. That is the one indication on here, not contraindication. So the contraindication is a known GI bleed. We don't want to cause more bleeding. What is not a contraindication of nitroglycerin? A blood pressure of 90/60. That's right on the line. A lot of protocols are 100 systolic or less, then you don't give nitro, you withhold it. A patient who has recently taken erectile dysfunction medications, that's a contraindication. A patient that has a head injury, that's also a contraindication. And then the patient took Viagra 72 hours ago. I believe it's in your book. So Cialis is the only medication, erectile dysfunction medication, with a time of 72 hours. The others are 24 to 48. So that is outside of that window. We would consider a contraindication. So that's the correct answer, is that the patient took Viagra 72 hours ago. You respond to a 27-year-old male complaining of dyspnea. Upon arrival, you find the patient seated in a tripod position on the edge of the couch, alert and oriented with a GCS of 15. Vital signs are a blood pressure of 120/80, heart rate of 100 a minute, SpO2 of 92% on room air, and end-tidal CO2 of 50. So remember, our normal end tidal is 35 to 45. So this is a little high. Upon assessment of the patient's lung sounds, they're present with bilateral wheezing upon exhalation. What is the most appropriate next step? Administer oxygen at 4 liters a minute by nasal cannula. Administer high flow oxygen by non-rebreather. Administer a breathing treatment or apply CPAP. The correct answer is administer a breathing treatment. So if we think about his end tidal's 50, so he's retaining CO2. He's having a hard time exhaling because you can hear it when he exhales. There's a lot of wheezing. There's some constriction happening. So we could give him oxygen. His SpO2 is 92. That's not great, but it's not horrible. Oxygen isn't what's going to fix his problem. The breathing treatment and a bronchodilator that helps dilate those bronchioles, that's what's going to fix him. You have a severely altered patient with a strong carotid pulse, snoring respirations, and an irregular respiratory rate from 6 to 10 breaths a minute. What is the most appropriate next step? I would have taken 2 answers for this. Place an airway adjunct like an MPA or OPA and ventilate the patient with the BVM. If you have a patient who began experiencing chest pain with exertion that resolved with rest, which of the following might you expect is the patient's condition? That is angina pectoris. If they had a pulmonary embolism or a STEMI, an acute myocardial infarction, that chest pain would not go away with rest. Which of the following is not part of the Cincinnati pre-hospital stroke scale? The answer to that is confusion. Arm drift, facial droop, and slurred speech, or incorrect words or the inability to speak, those are the 3 things that are in the pre-hospital stroke scale, the Cincinnati pre-hospital stroke scale. You have a patient who you suspect is suffering from anaphylaxis, and the patient is prescribed an epinephrine autoinjector. I may have led you guys astray on this one. I didn't put that the patient, oh, yes, I did. What is the correct dose of epinephrine for an adult patient? So the epinephrine autoinjectors are 0.5 milligrams for an adult and 0.3 for a pediatric. I do believe they make 0.15 for little ones, but the big ones we see are pediatric at 0.3 and adult at 0.5. You respond to an 80-year-old male patient with reported altered mental status. During your assessment and vital signs, you find the patient has a urinary catheter with dark urine present and the vital signs of a blood pressure 80/50, heart rate of 120 a minute, SpO2 91% on room air, a respiratory rate of 24 a minute, and a temperature of 102 degrees Fahrenheit. So there's 3 answers that could be correct at some point. So this probably started as a urinary tract infection that became septic and led to septic shock. The reason it's septic shock and not sepsis is because the patient's no longer compensated. When we talk about septic shock being a form of distributive shock, you know, that system gets overloaded, it tries to respond, and it dilates a bunch of vessels. So it is a form of shock. So sepsis is correct in a way, because sepsis is what led to the septic shock. But the most correct answer is septic shock. You have a patient experiencing drowsiness after possible exposure to a substance. The patient also has excessive salivation and has urinated on themselves. What type of substance might they have been exposed to? The answer is organophosphates. It's like pesticides. There's a mnemonic, sludgem. It's like salivation, lacrimation, urination, defecation, GI upset. The M is meiosis, which is constricted pupils. I don't remember what the E is. I'll have to look it up. So those things are indicative of an organophosphate or pesticide poisoning. So carbon monoxide, a lot of times that is headache, nausea, it can cause you to be unresponsive. Will lead to death if you're exposed to it long enough at high enough levels. Anhydrous ammonia is extremely, it is attracted to moisture. If there's almost any anhydrous ammonia in the air and you inhale it, you're going to die almost immediately. Cyanide's the same thing. You're not going to take more than a couple breaths of cyanide before you're no longer alive. You are with a 22-year-old female who reports severe hypogastric abdominal pain that began approximately 2 hours ago. The patient reports her last menstrual period was approximately 6 weeks ago. Based off these findings, what may be a likely cause of this patient's pain? The correct answer is ectopic pregnancy. She's not been pregnant long enough to experience the placenta previa or placenta abruption. And appendicitis doesn't normally present that way. An ectopic pregnancy is typically very painful. The correct answer is ectopic pregnancy. Bizarre and or aggressive behavior, shouting, paranoia, panic, violence towards others, insensitivity to pain, unexpected physical strength, and hyperthermia, usually associated with cocaine or amphetamine use, best describes which of the following? The correct answer is excited delirium. Coumadin, Lovenox, Eliquis, and Xarelto are examples of what types of medications? That is blood thinners. So that's important. The hospital may want to know if you guys have a patient, like a trauma patient, even a fall patient, they will want to know if the patient's on blood thinners. And it can kind of lead you down the path of certain history questions. Normally, patients are placed on blood thinners after some type of a cardiac surgery, a stroke, a heart attack, things like that. So if they're on a blood thinner, it's likely one of those things. I always ask if they know what they're on the blood thinner for. You have a young male patient who was ejected from a rollover vehicle accident. The patient reports pain to the right upper quadrant of the abdomen where there is already bruising present. The patient has the following vital signs: blood pressure of 100/60, heart rate of 110 a minute, SpO2 95%, respiratory rate of 20 a minute. What do you expect is causing the bruising and pain? So if we remember right upper quadrant, that's where our liver is at. So liver laceration is the correct answer. Your spleen is in your left upper quadrant. Seatbelt trauma, a lot of times we see that going, across the chest one way or another, and then across the waistline. You have a patient who had a piece of sheet metal fall on their arm while working. Upon arrival to patient side, you notice a life-threatening amount of blood coming from the patient's left forearm. What is your first intervention? Your first intervention should be placing a tourniquet high and tight. We don't do the 2 inches above an injury anymore. It's a life-threatening amount of blood loss that we're not able to see yet. So by placing a tourniquet high and tight, even if it's over the clothing, we stop the bleeding. We can expose the injury later to see if we want to convert that to a pressure dressing, but the immediate need is to stop the bleed, which is going to happen if you put that high and tight tourniquet. You have a patient with partial thickness burns to one arm, the chest, and the abdomen. What is the total surface area burned? The correct answer is 27%. So remember, you have one arm, the chest, and the abdomen. So we have the little dance. If you can remember that, that's going to help you. You have one arm, that's 9. You have your chest, that's 9. You have your abdomen, that's 9. It's 27. Which connective tissue connects bones to bones? That's ligaments. Which of the following is not part of splinting a possibly fractured extremity? Assessing reflexes. So we want to make sure that there's good pulses and motor skills and sensation before and after splinting. splint the injured site as well as the joints above and below or proximal and distal to the injury. And depending on what it is, consider a sling or some other means of stabilizing. When the heart is injured and blood makes its way into the pericardial sac surrounding the heart, this is called cardiac tamponade. Which of the following is not part of the lethal trauma diamond? So remember, we have hypothermia, acidosis, coagulopathy, and hypocalcemia. Those are the things those are the 4 components of the lethal trauma diamond. So hypokalemia or low potassium is not part of that. The correct compression rate for CPR is 100 to 120. A lot of you put the correct ratio of 30 to 2. So I didn't mark any of those wrong. If you put the right ratio, that's cool. But the rate is 100 to 120. In the cardiac arrest setting, once a supraglottic airway or endotracheal tube is placed, the compression to ventilation ratio changes from 30 to 2 to a continuous compression rate and a ventilation rate of 10 to 12 a minute. That's true. You are partnered with an EMT basic on a rural 911 ambulance service. You respond to a single vehicle motor vehicle collision with one reported to be entrapped. The weather is 70 degrees, low wind in the early afternoon. The scene is approximately 45 minutes from the nearest trauma center. What is a consideration to discuss with your partner while en route? Several of you put contact dispatch to request ALS ambulance assistance. I didn't mark that wrong. That's a good thought. Discuss expeditious extrication and rapid scene time to transport the patient within the golden period. Probably going to stray away from that one if we can avoid it. Discuss extrication tactics in the case the fire department needs assistance. It's not really our job. If that needs to happen, it can happen, but not really our job. The correct answer is contact dispatch to request a medical helicopter. So if it's 45 minutes by ground, it's probably about 8 minutes by helicopter. So if they're already trapped, by the time they get the patient extricated, the helicopter could already be on scene. So the transport could be 8 minutes to the hospital instead of 45 minutes. So the correct answer is contact dispatch to request a medical helicopter. You respond to a 50-year-old male for complaints of altered mental status. Upon arrival, you find the patient responding to verbal stimulus with confused conversation but can follow commands. The patient's skin is diaphoretic and cool. Your glucometer reads an error code. What is the patient's GCS and what do you expect this patient is experiencing? So the correct answer is a GCS of 13 and hypoglycemia. Remember, hypoglycemia, the patient's going to be sweaty, cool. In hyperglycemia or high blood sugar, the patient will be warm and dry. Which of the following is not a sign of tension pneumothorax? The correct answer is chest pain. So absent lung sounds on the affected side, tracheal deviation, and jugular vein distension are all signs of a tension pneumothorax. So I've graded everyone's tests. I've made notes on them. I'll give them back to you if you want at the next class. Thank you.